Another world is not only possible, she is on her way. On a quiet day, I can hear her breathing. That's a quote by Arundhati Roy that regularly inspires me and inspired my leadership project. It's a collection of stories about girls and young women who chose to transform the health of their communities. I'm Katy Ashe. I'm the interim CEO of Y Labs, Youth Development Labs. So I chose to detail stories of health services designed by and for women and girls who recognize a problem in their community and design grassroots services that are anchored in their lived experiences. I chose case studies that were intended for a mixture of audiences, technical experts, funders, and just people who needed to understand and be inspired about what is really happening when we say global health. And as we consider about how to rebuild and build back global health stronger and stronger systems to be more effective and more just, I wanted to spotlight women-led grassroots efforts that offer practical, empathetic, and highly scalable models over predominantly top-down. I wanted these case studies to reflect not only what works, but why it works, and challenge people to rethink how we design and fund health interventions that center dignity, creativity, care, and experience. Um, Over the past 16 years, I've had the incredible privilege of working alongside inspiring women in communities all around the world. And that's really what's kept me going. Co-designing health interventions that are beloved by communities, low cost, and have reached over 50 million people to date. I wanted to share inspiring and complex firsthand stories of women who witness a challenge in their community and lead efforts to create a solution. When global health basically imploded this year, I wanted to pivot my leadership project into something that would remind me why. I needed this project to be something that just kept getting me out of bed um, and occasionally putting on pants. So over the course of the project, I sent over 5,000 emails. And I think the most pressing part was over half of those emails bouncing back because of the amount of scale back that had happened in global health. Over 200 case studies were submitted, and I interviewed over 80 women about their personal experiences. I wrote 12 case studies and a 100-page report about the learnings, especially focused on the intersection of climate change and women's health focused in South Asia. I hosted a webinar where we invited hundreds of experts, researchers, and funders to hear the case studies directly from women featured in the case studies, and we'll be holding an in-person convening in Delhi in March. These are the two reports that I wrote, a collection of case studies and the landscape assessment, which you can find at climate-srhr.org. I was able to use this year on this leadership project to talk to a lot of very incredible women who do incredible work that is also extremely underfunded. And I was able to put them in front of audiences that they typically struggle to connect with. I know several organizations that have directly received funding from this project so far. It's been a really positive feedback loop for the women involved, the funders who typically can struggle to connect with grassroots organizations ready to scale, And this project kept me going from day to day. And now that it's caught momentum, I don't really plan on stopping. Thank you.